Reina Schiffrin, President and CEO of Planned Parenthood Hudson-Peconic. First, I want to clarify a few things said tonight. 90% of what Planned Parenthood Hudson-Peconic does is preventive care. We absolutely always provide options counseling, which includes prenatal, adoption, and other options. So I want to clarify that. Thank you for your opportunity to speak to you about access to reproductive health care facilities. PPHP operates, as Michael said, 12 health centers serving 35,000 patients a year. Here in Westchester, we're in White Plains, Yonkers, New Rochelle, and Mount Vernon. The majority of our care is preventative, which includes life-saving cancer screenings, birth control, screening, testing, and treatment for sexually transmitted infections and HIV, the HPV vaccine, and prenatal care. We also provide abortion care. We strongly support Resolution 2011-182, the Reproductive Health Care Facilities Act, as the best way to significantly reduce the harassment and intimidation that too many of our patients experience when they come to us for health services. In 2009, the Hudson Valley Coalition for Life's blog touted a success story about their ability to convince prospective Planned Parenthood patients not to seek health care from us. A 16-year-old girl and a 14-year-old boy were on their way into our Yonkers Health Center for a pregnancy test. That's their right. The protesters' fear tactics, and many of you are in this room, convinced them that it was better to take an in-home pregnancy test rather than talk with trained medical professionals. According to the Coalition's blog, the girl had already experienced one miscarriage. Imagine that you're in the shoes of this young couple. It's unlikely that you would now start to practice abstinence. And if you've had one pregnancy and a second pregnancy scare, it's safe to assume that you're not using a reliable form of birth control. Now that the protesters have convinced you to choose a home pregnancy test, you've missed out on the opportunity to learn about reliable forms of birth control, which are legal in this country, as I recall, as well as the public health programs that could help them pay for their health care. If you're pregnant, they have deprived you of an opportunity to start talking about prenatal care right away and not later when it becomes high risk. Prenatal care is one of the services we provide at our Yonkers Health Center. The intimidation and the harassment of our patients continues today, more than 2 years later. There has been no relief or abatement. On the proposed bill, arrests could be made on observation alone if a protester is knowingly obstructing or blocking the premises of a clinic. No patient or doctor has to come forward and risk their own privacy and their own life to push for a prosecution. Our doctors wear a bulletproof vest, thanks to the people in this room. It also allows the reproductive health care facility to bring a complaint about protesters' activities to law enforcement. On behalf of the 35,000 patients we serve, I urge you to pass Resolution 2011-182. I am responsible for 175 employees and thousands of patients, and if my life depends on it, I'm keeping it safe for them. Thank you.